Okay, I'm sorry I was interrupted. So back to this recording. Like I said, a little backtrack. Dr. Weigel, she came into my room. She literally just barely touched me. Like I said, like I was some type of bug, insect, or I was gonna reach out and bite her. Uh, I've never had an examination that fast. Like it literally took her 30 seconds or less. Uh, that's when she told me go home, quarantine, and clean my toilet. I don't know, indicating that I don't clean my toilet. So anyway, like I said, normally I am a great advocate for myself and my health. Uh, I know the medications that work for me. I know the ones that don't. I know what I'm allergic to. I read side effects, and if I have any type of side effects from any medication they give me, I discontinue taking it. Sorry, I'm still having problems breathing due because my lungs collapsed and everything with the COVID. So anyway, let's go back. Uh, Nurse Anna, that was her name at the time. Anna. I didn't get Anna's last name, but awesome, awesome, wonderful person. She said she looked at me, and when the doctor left out, she said, "I don't think you should be going home." And she said, "I'm going to go talk to her." So because I guess she saw I couldn't be an advocate for myself, she went and did it for me. Now, doing all this process, I asked Dr. Weigel, I said, "What about my COVID test? Did you get that back?" She said, "Oh, no, it didn't come back. So just go home and quarantine for 14 days." I asked her, "What about the pneumonia?" She said, "Oh, you don't have pneumonia." And I'm like, "How did you get that I don't have pneumonia when two doctors in ER in less than 24 hours told me I had pneumonia?" And that's why they were admitting me. Well, she said, "Well, you don't have pneumonia. Once again, go home, quarantine for 14 days, and clean your toilet." Wow. So she left out. And Anna left out with her. And then she stuck her head back into the door, Dr. Weigel. Like about 2 minutes later, she just stuck her head in the door. Didn't come back over to listen to my lungs again or nothing. Just said, "Oh, your COVID test came back. It's positive. But go home and quarantine for 14 days. And don't forget to clean your toilet." She put more emphasis on me cleaning my toilet than what I need to do other than quarantine to help myself. Like, why not tell me to drink hot liquids and, you know, give me the proper antibiotics, to help me? None of that took place. That's all she told me. She left out. I never saw her again. Anna went to be the advocate for me to tell her, "I don't think we should send this lady home. She's sick, really sick." Uh, she said, "Well, she's not running a temperature." Well, of course not, because you have IVs in my arm and you're running fluid through my body. So normally the temperature will go down, you know. So she said she can go home. She can go home. Just tell her to go home and clean the toilet. Wow. So, being that I was really sick and I was just frustrated with this lady, I just called my husband, and and I was like, "Just come and get me." So he picked. Finally, they end up. Like I say, we he picked me up about 5:30 because by the time she came back with her decision, she claimed she talked to the CDC, but I doubt it. This lady did not talk to the CDC. This lady just did not care, because like I said, remember in the beginning, I said when she came into the room, she treated me like I was an insect or a bug, and I was going to probably bite her or sting her. So she didn't want to touch me anyway. And she showed that. So after that, my husband picked me up. We came home. I got in bed. I was sick I hadn't eaten nothing prior to even going to the hospital that whole week. I was in bed all day, the rest of the Saturday, all day Sunday. Couldn't eat anything, couldn't hold anything on my stomach. Uh, Monday, all day. And each day I was just getting weaker and weaker. Breathing was getting harder, coughing was getting worse, asthma. You don't send someone that's asthmatic and high blood pressure home with COVID. When they came in, and I came in with a temperature and my oxygen level was down. So uh, by that Tuesday afternoon, I called. I was so sick I could barely set up. My husband was trying to spoon feed me to get me to eat. None of that worked. She never told me discontinue taking the medication that I was instead of giving me something else. One antibiotic, she did say stop because it was making me really sick. But she never tried to prescribe anything else. So I say about 4:35, I just felt my life slipping away, and I called my best friend Gerald Smith, and she started screaming on the phone. Well, I called her to say if anything happens to me, you can find my paperwork here, there, and there, because I knew that if something seriously happened to me, my husband or my kids probably wouldn't been able to find stuff. So Gerald is always my ace in the hole, Gerald Smith or Gloria Lewis. So I called her to tell her that, and she started screaming on the phone, and she's like, "You need to go back to Kaiser. You need to go back right away, right now. I'm going to call Al, who is my husband, Al Threeks." And I said, "I'll call him. He's probably downstairs, so I'll call him." But and we hung up. By the time I got ready to call him, he was already coming through the door. He said, "Gerald just called me. Let's go." I wanted to get cleaned up because I had been in bed for all those days. So he helped me clean myself up. We get to Kaiser. By then I can't hardly move. They had to literally help me out the car, put me in a chair. My temperature then was like 100.4, something like that. Maybe give or take some numbers off, but it was high. My oxygen level was really down, probably down to about, I don't know, about 30, 40. I'm not sure, but I know it was really low, that they rushed me straight into ICU. I didn't go through the triage nurse, just straight back to ICU. They started working on me immediately, drawing blood, and they started doing the x-rays. When they did the x-rays, Dr. Chan, he told me, he said, "Well, this is what's going on. Your left lung has collapsed and you're breathing like 20% on your right lung." And they couldn't figure out how I was sitting there talking to them. And I told them, I said, "Okay, what's next?" And they said, "We got to incubate you, which means we have to put you under and put you on a ventilator." And naturally, your first thought is, "Oh my God, you're going to put me on this ventilator and you're going to let me die." And I pretty much expressed that to them. "Please don't put me on this machine and let me die." And Dr. Chan, he was like, "I promise you I'll do everything in my power to keep you alive." And he told me, "I'll be there when you wake up, you know. And that was reassuring, but I put my trust in God and no one else. So what happened after that? The next thing you know, I'm under, but I'm still trying to, I'm under, and I'm thinking I'm under a few days. When I finally come out from under the ventilator and they bring me, the first time they bring me out, I couldn't breathe on my own. So they put me back under for a few more days, and then they slowly weaned me off the machine and stuff. And Dr. Chan was there, Dr. Maestri, Mystery, Mistry, just in case I'm not pronouncing your name right, Dr. Maestri. And I remember Dr. Singh, I think, the three of them. And when I came from under it, and I talked to my husband, and still thinking I'm only been in the hospital a few days, to find out I had been on the ventilator for 2 weeks, which is definitely grace of God because they only give you 20% chances on it. But my whole thing is this: how can someone diagnose me, two doctors diagnose me with pneumonia, admit me, another doctor comes along who don't give, who just don't care. She saw I was black, and I'm telling you, I felt like that from day one. She looked at me like I was some type of insect, a bug, or uh, and I don't get all of that about, oh, they probably was scared to touch you because of COVID and stuff. I had mask on. She had the mask on. A lot of doctors up in there are frontliners, are dealing with COVID patients, and they do right by them. This doctor has no business practicing medicine. She did not care. She sent me home to die. I really, literally feel like that this woman sent me home to die. She didn't care. She didn't bother rerunning the tests on me or even looking, or did she ever read the ER doctor's report? For them to admit me, it had to be a solid reason. She told me I didn't have pneumonia, and oh, yeah, your COVID test came back positive, and just go home, quarantine, and clean the toilet. How can someone go from having pneumonia and not having pneumonia in 24 hours and having COVID, but okay to go home? Even when I expressed to her, I had an elderly mother in law at home who was 86, and my husband, who's a senior citizen, who's 68, and they both have underlying factors. And we don't have anyone to really come in and take care of us. So, you're putting me at risk and you're putting them at risk. She did not care. And how can you not have pneumonia and you're not concerned about anything? And 2.5 days later, you're on a ventilator fighting for your life. I'm not blaming Kaiser because Kaiser has been nothing but good to me, and I want to put that out there. Through some other situations where I had back surgery, Kaiser took care of me. So I'm not blaming the hospital or the organization as a whole, but I do think that that the hospitals need to start screening their doctors very well. When I made the complaint to Kaiser on December 10th, no, I'm sorry, on November 10th, I got a letter back from them regarding the complaint. Uh, and they told me, and I'm just going to read this letter. Thank you for contacting us on November 10th, 2020, letting us know about a visit you had at the emergency department at the Kaiser Permanente South Bay Center on March 20th. We are writing in response to your grievances. You explained that you were dissatisfied with the quality of your visit. Now, first of all, I told them it was not the ER, it was the doctor, the internal medicine doctor. So I'm not going to read a lot of that. They tell me the chief of director and ED to review, yada, yada, it is. But this is what's important. I also shared your concerns with a chief in the family practice department and a chief in the hospital-based specialty department for eternal review and actions as deemed appropriate. The ED chief mentioned that there may have been some related concerns in the family practice department based on the name of the involved physician you specified in your grievance. Wow. So apparently people have complained about this woman before, but they did nothing about it. Now on that part, I blame Kaiser. Because if you're getting grievances from patients about the same physician, you need to look into your uh, qualifications and background and everything. Don't hire people just because you're short of help and you think that they are the best ones. This lady cared nothing about anyone, and I'm willing to bet that if they dig in their records, if I had someone to look back into, she's probably sent a lot of people home from under her care, and from under her care, I'm willing to bet some people expired, you know, passed. And so I guess they wrote me that letter, and then I was like, oh, no, no, we're not supposed to do that. So they sent me another letter the same day saying we're writing to let you know your grievances filed on November 10, 20 for a date of service on March 20, 2020 is being dismissed to untimely filing. Please note a grievance must be verbally or in writing within 60 calendar days of the event, which is subject of which is the subject of the grievances. Wow. So okay, a lot of people gonna ask, why didn't you file it right after you got out of the hospital? First of all, if you don't know what it's like to be on a ventilator, I'll tell you. If you don't know what it's like to have COVID-19, I will tell you. Your whole body aches. Nothing is functioning right. Nothing. Not your mind, nothing. COVID can take over your whole entire body and make you feel like you nothing like you ever had in your life. On top of that, I'm asthmatic, and to go on a breathing machine for 2 weeks, and I'm still having the after effects of it with shortness of breath and oxygen, the need of oxygen when needed, and I have a oxygen purifier machine that I pretty much sleep with every night. And the PTSD that you deal with after COVID, is horrible. Mental wise. For months, I could not even look at the news on television. It was just frightening. And I had nightmares of me being on a ventilator. So when I finally was able to talk about it, I decided to contact Kaiser and reach out to them and say, look, you know, you got a doctor that's sending people home and they're killing people, especially black people. Then I see it on the news where this black doctor goes into the hospital and they pretty much treat her like I was treated, sent her home, told her she had COVID, sent her home, told her to go home and quarantine. She got home, she got worse. Uh, 2 days before she made a recording about it, 2 days before her death. She made the recording, and 2 days later, she died. What happened to me, I don't want to see happen to anyone else. Not just black people, not just Hispanics or Asian or Filipinos or minorities, but really as a woman of God to no one. But it is a known given fact that my African Americans are treated totally different when they go into the hospital and to the medical centers. We're treated differently. You know, we we wait longer and everything. The doctors act like they just really don't care. I guess they think we're just hypochondriacs, that we're coming up with illnesses, but no, not so. Sorry, I get your breath a little bit. Like I said, I'm still dealing with this thing really bad, especially the breathing part. But I'm pushing through things, and with the help of God, my body will get back to normal. But something has to be changed. We pay our taxes like anyone else. I've been working since I was 14 years old. Uh, my parents taught me how to work. I've raised my children And yes, at times I had to be on the system, but I pulled myself off of that. And I got good jobs and I was able to take care of my babies. I'm not asking you to give me anything, but at the same time, I am asking this. It's for time for a change. We need to stop. Well, the system needs to stop allowing the medical profession treat minorities like we're nothing. And black people, if we don't speak up for ourselves, nobody is going to speak up for us. I can guarantee you that. No one. So anybody that has lost a loved one or go into the hospital and you're not treated, you feel you're not being treated fairly, let your voice be heard because we're not being treated fairly. We're being treated like I said, bugs, like you're an insect. They don't want to touch you. And it's just time out for that. Yes, a lot of African Americans have died with COVID. And it's not because we don't wear our mask. It's because by the time it hit, and most of us had contracted it, and we didn't get the same treatment. Maybe if we would got better treatment, a lot of us would have lived. God allowed me to be here because maybe I need to be that person to speak up for us. But I can honestly say, whoever listens to this tape, we're not being treated fairly at all. And I know a lot of people out there have gone into hospitals and been ill and just sat there and sat there. And you've seen other people of other races come in after you, go into rooms, get treated, and then come out and go home. And we're still sitting there. It's just too much. And I'm going to say this and leave it alone. My 87-year-old mother-in-law, we felt that she had a mild stroke on Sunday night, which was December 28th. And we called paramedics because she had all the symptoms of a stroke. Even the paramedics came here, a couple of them, act like they just really weren't concerned. I'm trying to tell them what went on with her. They're talking all over me, talking to their partners and yada yada this, which really pissed me off. They take her to Little Company of Mary. Now, this is an 87-year-old lady that if we say impossible stroke, the first thing you should do is take her in, run a CAT scan. If the CAT scan don't show anything, run an MRI because something will show up. They claim they did the CAT scan, and but this is the clincher. They had her sitting in the hallway for at least 3 hours, maybe more. We told them like this little lady, she stays cold. She's always cold. We had to force the paramedics to take a jacket to put on her. And she sat in the hallway at Little Company of Mary for hours. So no, we don't get treated the same. Thank God she's okay. But black people, pay attention to your loved ones when you take them into the hospital. Don't take for granted that these doctors are going to give your loved ones the top care. They're not. A lot of them not. Especially, I'm going to say it, the white doctors. My team, all praises and shout out to the team of doctors and nurses that took care of me when I was in ICU on a ventilator. Dr. Maestri, Dr. Chan, Dr. Sang, another nurse, I think her name was Ann or Emma or Anna, the head nurses, everyone that came in contact with me. Will you be? I'm forevermore grateful, and you'll always be in my heart. That you honored your profession. You took care of me and helped save my life. I am grateful. I am thankful that God put me in contact with the people that needed to be in contact with me. And for that, I praise God for that. Thank you for anybody listening. I know this is kind of long. I didn't anticipate it on being this long, but maybe you can help someone save a loved one's life or save their own life. Thank you. Remember, her name was Dr. Gilda Weigel, Vigel. Just in case she's not at Kaiser no more and you run across her at another hospital, be aware. She does not care for you. She's going to say, go home, quarantine, and clean your toilet. Unbelievable. Thank you and God bless.